The humerus nail system is used for the comprehensive treatment solution of humerus fractures. The humerus nail is divided into two types, long nail and short nail. Both types are made of titanium alloy material. The choice of nail depends on the type of fracture. Nail locking screw 5 4.5 mm large head and nail locking screw 5 4.0 mm large head have the same core diameter, requiring a 3.5 mm drill bit for use. There are 4-point degrees of bending angle for humerus nail. Both types of nail have 6 screw holes at proximal part and 3 screw holes at distal part. The proximal hole features a semi-locking hole mechanism for added stability to prevent loosening during surgery. Position the patient in a supine or beach chair position for the procedure. Give an incision of 3 to 5 centimeters at the surgical area. Set the position to insert the guide pin at the entry point. Assemble a protection sleeve, drill sleeve, and trocar and insert them into the incision site. Determine the position for guide pin insertion and remove the trocar. Insert the guide pin to the appropriate depth using a guide pin holder. Remove the drill sleeve and using the guide pin as a guide, insert the start reamer until the reamer head reaches the desired location. Subsequently, remove the start reamer, protection sleeve, and guide pin in sequence. Alternatively, can be used all with a T-handle for reaming or drilling. For inserting the long nail, canal expansion may be necessary. Insert the ball-tipped reaming rod into the medullary canal to the desired depth. Use a flexible reamer shaft to start with a 7 mm start reamer and increase by 0.5 mm increments until achieving the desired size. After reaming, do not remove the ball-tipped reaming rod. Confirm the bending direction of the nail. Assemble the nail and assembly handle with assembly bolt and secure them firmly with a wrench. Once the nail and assembly handle are assembled, insert the nail along the ball-tipped reaming rod. Attach the impact handle if necessary. Impact the nail to the desired position and remove the ball-tipped reaming rod after insertion is complete. Assemble the proximal target device to the assembly handle and tighten the assembly bolt. Insert the guide pin at the end point targeting, adjust it by the end of the nail and check the depth. Insert the protection sleeve, drill sleeve, and trocar through the proximal holes of the proximal target device. Remove the trocar and insert the calibrated drill bit to drill until reaching the level of the bone below the articular cartilage. After drilling, remove the drill sleeve and trocar and use a depth gauge to confirm the depth. Select a 4.5 mm nail locking screw of the appropriate depth and insert it through the protection sleeve of the proximal target device. Use freehand technique to tighten the screws at the proximal part of the long nail. Use 5 3.5 mm drill bit, since the core diameters of nail locking screw 5 4.5 mm and 5 4.0 mm large head are the same. Use freehand drill guide to correctly drill at the center of the screw hole. Check the depth with depth gauge and insert the screws. For securing the distal screw of the short nail, secure the screw in the same manner as proximal locking screws, but using the lower distal holes of the proximal target device. Attach the selected end cap to the end cap driver and secure it with the coupling screw on the driver. Insert the secured end cap into the top of the nail and secure it. Once the end cap is secured to the nail, release the coupling screw from the driver and complete the procedure. After removing all distal and proximal screws from the nail, assemble the extract rod with the assembly bolt and remove the nail. If resistance is encountered, gently use a slotted hammer, pointing it upward along the extract rod, and apply careful blows until the pin is removed.